Now live, Chairman.
Okay. Just repeat once more, but may I remind everyone present this meeting will still be broadcast live via the internet and record will be archived for future viewing. And that any member of the press and public may listen to the proceedings via a web link which has been publicised on the Council website. The participants of this meeting will be the members of the Scrutiny Board and the officers presenting reports. May I remind officers and members participating during the meeting, all participants are in control of their own microphones. I'll now take a roll call to confirm that members are present at the meeting. So, members present are Councillor Diane Howell. Well, gotcha. Councillor Katie Blunt.
Doesn't look like Councillor Blunt's joined just yet, Chairman, but I'll keep an eye out.
Councillor Pinwell. Yep.
Yes, I'm here. Thank you.
Councillor Annette Mackenzie. Yes, gotcha.
Present.
Yeah. Councillor Was Mackay.
She's not on the board, Chairman, so I don't think she'll be attended.
Okay, that's fine. It's in my list here anyway. Councillor Marcus Brain.
Present.
Good. Councillor Steve Cordwell.
Evening.
Thank you, Steve. Councillor Rosemary Sexton.
Present.
Excellent. Oh yes, I can see your Councillor Richard Long.
Yeah, hi.
Maybe Richard. Also present is the Cabinet Member for Adult Social Care and Health, Councillor Tony DeSico. Welcome, Tony.
Welcome, Martin.
Thank you. Are there any apologies?
There's been none received, Chairman, but as it's an informal meeting, it won't.
Yeah, there won't be many said anyway. Yeah. Any declaration of interests? I hear none. Questions and deputations. There are no requests for questions and deputations have been received. Item 4, minutes. For the Scrutiny Board to note the minutes of the meeting held on 9th of November 2021. Has anyone got anything to raise? Are you happy with the minutes? I take those as accepted.
Just to confirm, Councillor McCarthy, they'll have to be formally approved at the next meeting, but any comments will be taken on board now. Thank you.
Right, item 5. Well, we've got 2 items this evening. They sound like they have some similarity, but they're actually as different as chalk and cheese. So if we go to the first item, progress on exploitation reduction for adults in Solihull. This is initially, this is a fairly, what appeared to be a very officer-friendly report. We've had a little pre-review of it, and we should have some presentations from the officers to add a little colour to the report. As this particular item is a very, very sensitive and an item which deserves our fullest attention, absolutely our fullest attention. So this is to update the Health and Adult Services, the board, on the progress of the Exploitation Reduction Board and Exploitation Reduction Delivery Group with respect to supporting adults at risk of or experiencing exploitation. Right, the officers are Lizzie Edwards, Assistant Director, Service Delivery, Adult Care and Support, Rachel Eves, Adult Exploitation Reduction Lead, Adult Care and Support. Okay, Lizzie, do you want to kick off?
Thank you, Chair. Yes, Joe is going to share some PowerPoint slides, so hopefully they will come up in a moment. Great, thank you, Joe. Thank you, everyone. Hopefully you've had an opportunity to have a look at the report. Just to emphasise, this is an update in relation to adult exploitation, So rather than all age, we are focusing on adults at risk of exploitation, so individuals aged 18 plus. Just to let you know that we do have Rachel Eves here, as the chairman said, and we also have Beth Hutchinson, who's head of service within adult care and support and the lead for this area of work. Could we move to the next slide, please, Jo? So we thought it might be helpful to just start with a refresher on what exploitation is. So what do we mean by exploitation? So it's deliberate maltreatment and manipulation of individuals. So many of you will have heard of sexual exploitation, criminal exploitation, human trafficking, modern slavery, which also includes criminal and sexual exploitation. So all of those fall under exploitation. So I think initially a lot of the focus was on sexual exploitation, but now there are the kind of wider categories of exploitation, just to help with your understanding. In terms of signs and symptoms, that's been a developing piece of work to understand who's at risk and who is experiencing exploitation. But individuals might have unexplained money or presence because the exploiter, who's the criminal in the situation, is giving them money or presents, and you're not sure why. They might have drug or alcohol misuse. They might be not engaging in the situation with other professionals or their friends and family, and they might have made new friends or made new relationships that are kind of out of the blue. Could I go to the next slide, please, Jo? Thank you. So many of you will remember that we did have a safeguarding adult review in 2017. So this related to the unfortunate death of a lady in Solihull that we called Rachel for the purposes of the safeguarding adult review. So that wasn't her actual name. So the Safeguarding Adult Board led on this work jointly with the Children's Safeguarding Board, it was at the time. Rachel was unfortunately the victim of sexual exploitation and trafficking from the age of 17. And a lot of the work of the Exploitation Board and Delivery Group and the work that we're reporting on today came as a result of that Safeguarding Adult Review, because there were findings that related to multi-agency working and how agencies in Solihull, like social care, the police, health colleagues, could work more effectively to reduce the risk of exploitation in the borough. There were also findings relating to procedures or policies. So in terms of social workers, frontline police officers, frontline health staff having procedures and policies to understand what to do if somebody was at risk of exploitation. And there were also findings in terms of awareness raising and the awareness of exploitation in the borough and how we could do more to promote that. Could we move to the next slide, please, Jo? So as a result of the findings from the Rachel SAR, we created this multi-agency exploitation reduction board and delivery group. So the board is chaired by Jenny Wood, the Director of Adult Care and Support, and we've got full involvement from partners, including West Midlands Police, our health colleagues, public health. So there's a list on the slide there in terms of the attendees at the Exploitation Reduction Board. That board is all age, so it considers children, young people, adults, but like I said earlier, this update is in relation to adults at risk. And then we also have the Exploitation Reduction Delivery Group, which is chaired by West Midlands Police. That has more of a practice focus and a kind of, doing the doing, as you'd imagine from the name of the group, the delivery group. I'm going to hand over to Rachel now for the next slide, please, Jo. And Rachel's going to give you an update in terms of some of the specifics that have been happening in Solihull.
Thanks, Lizzie. Good evening, Chair. So, as outlined in the report, there's been lots of positive progress, including the creation of a lead post to coordinate all the work relating to adults, which is my post. We also have a social worker that's working directly with adults and risk, and that includes individuals who might not have ordinarily met the Care Act eligibility criteria. We've developed a communications plan, and some of those materials were appendices to this report, and these are aimed at raising awareness of the risks of exploitation with the general public and people who work with the public as well. We've been developing a programme of training, and we've agreed mandatory training for all SMBC staff who have regular contact with the members of the public, and counsellors can also have access to this training as well. We've also developed all-age procedures and an all-age screening tool, and this screening tool is for children and adults, and it's to help identify those individuals who are at risk of exploitation. Next slide, please, Jo. So we have already seen a positive impact directly on individuals that the social worker has been working with, where we've reduced the risk of exploitation by working with our key partners such as the police, health and housing in order to reduce exploitation to these individuals. We've received positive feedback from the National Working Group for Exploitation for our innovative practice, and that's particularly in relation to our transitions work. From children's to adults, and also the all-age approach, and the adult lead of that as well. So we have adults leading in the transitions work, which is something that isn't usual in the country. As outlined, there's also further work that we're going to be doing in the coming months as well. Thank you, Chair. We're happy to take any questions or comments.
Right, my first, I'll kick off with a few questions. The Exploitation Reduction Board, is this group open to councillor representation of any kind?
So thank you, Chair. It isn't. It's an officer group, so obviously including other organisations as well. But due to the nature of the discussions around sometimes talking about individual perpetrators or people at risk, it's an officer group, so not open to, or no councillors are represented on that group.
Okay. Other question was, what progress are we making with making training for councillors available in these issues and the work that the council's doing?
So the council has actually just this week signed off a paper to make exploitation awareness training mandatory for all staff that may come into contact with members of the public. So that's like an online training programme, and that we could make that available to councillors that are interested. I know that the safeguarding training that is available to councillors anyway does cover exploitation reduction, but if that training would be of interest, we could make that available. Chair, it's a kind of like a PowerPoint presentation, so we could share that with members if anyone wants to see that.
Because I found myself while going through this report, there are items like in 3.7 indicators of exploitation. And I wanted to be really clear about what these were and how you dealt with them. Because one of the things that was mentioned was the Rachel report. Having read this report, it makes quite harrowing reading, and it shows the urgency and the impact of the work that we're doing, because the ultimate result that we can end up can be, it's not something that we want to really continue with.
Thank you, Chair. Yes, definitely. I'm sure other members will have seen the Rachel report at the time. That is available on the Safeguarding Adult Board website, but we can definitely make the e-learning available to councillors if that's of interest.
You talked in your slides and in the report about the 4-phase communication plan. Have we got any timing for those plans?
I will ask Rachel to answer that one on our behalf, please.
So phase 1 of the plan was the launch of the strategy, which was in December 2020. Phase 2 of the plan was launch of the procedures, which was March this year. Phase 3 is launch of communications and awareness raising to people who work with members of the public, and that's going to be January 22. And phase 4 is communications awareness raising to the general public, so children, adults, parents, carers, and that will be in March 2022.
Okay. Would members like to come in on any of those points? Councillor Mackenzie?
Thank you, Chair. Thank you, Lizzie and Rachel. Just to clear up one thing, you mentioned that it was all ages, children and adults. From 3.91 to 3.96, there's no mention of schools or colleges. Should they be mentioned within all these other places, hotels, guest transport?
Thank you, Councillor Mackenzie. So the reason we haven't focused on that in this report is because it's an adults update. However, the Children's Safeguarding Partnership are doing some work in schools and colleges, so I'm sure they'd be able to provide further information if that would be of interest to councils, but they are on the list in terms of receiving communication.
Oh, could I sort of follow up on that a little and say, is this an all-age plan anyway?
Thank you, Chair. Yes, the communication plan is an all-age plan. So the wider plan does include additional groups like youth clubs, schools, colleges. However, this update is in regards to adults. So the Children's Safeguarding Partnership is leading on the children's work in conjunction with children's services.
Okay, thank you. So, Councillor Pinwell.
Thank you, Chair. Can I say firstly that it's really great to see this focus on a wider view of safeguarding and particularly the communications plan that brings the community into the picture in terms of recognising signs. I know that our friends in the Seroptimists have been promoting such an idea for some time, and it's great to see it actually happening. I've got 3 questions. I'll take them en bloc or one at a time, whichever you would prefer.
One at a time, preferably, yes.
Okay, first question. So it may be too early, I don't know, to have any results against the 9 quantitative measures that were set out in the strategy in the first place. Is it, or are there some quantitative results that can be shared?
Thank you, Councillor Pinwell. Rachel might want to add more. I mean, from my point of view, we have seen some individual successes with people that the social worker has been working with. We've also seen awareness raising in terms of kind of those frontline roles across the council. We've seen agencies working together really effectively, but we've really not got the data yet in terms of showing the improvements in reality. So that is part of our programme of work to review how things are going kind of at the 6 months, at 12 months and on an ongoing basis. So that is planned in, but it's a bit early at this stage to give anything concrete. Rachel, is there anything you want to add in terms of successes or evidence that we've got around that at the moment?
I think just one other one to add would just be around the key working relationships and commitment we've got from our partner organisations to reducing exploitation, and we are linking in very well with other organisations and working together for individuals and also for the wider strategy in order to reduce exploitation by putting the procedures in place and those things. So as Lizzie said, that will take some time in order for us to be able to evidence that they're working. But I think in terms of the people that we're working with already, we're already evidencing that that we're working with people that wouldn't necessarily have received support before, and therefore there are some positive outcomes there.
That's good. That's good. Just to clarify the answer on that, presumably you have gathered together baseline results against those 9 quantitative measures, though, against which you can measure the improvements going forward?
Yes, that's right.
Okay, great. Second question, there was no mention in this report that I could find about the vulnerability tracker, which you published the launch of at the very beginning of the year. 12 months on, how's that going?
Yes, we haven't mentioned that specifically in the report, but Rachel can provide an update if that's okay, Rachel.
Yeah, thank you. We've been working really hard on the vulnerability tracker since January, as you rightly said. It was launched. We are working really well as agencies together to try and collate information, demographics on what exploitation looks like in Solihull. And as Lizzie said before, this is where a lot of our data gathering has started. We're not in a position to be able to provide that information as such, because it's still in process and it's developing as we're going through the year. But it's been really helpful in terms of us trying to link some indicators and some risks in order to look at the bigger picture in terms of how we can reduce exploitation as individual organisations.
So have you got a clear indication of the sort of timescale which will be required to get sufficient focus into that demographic picture?
So we do. So although it's not a kind of a full picture at the moment, Councillor Pinwell, we do have information on the vulnerability tracker that we wouldn't have had as a kind of multi-agency partnership before. So we are tracking individuals and we're getting information from the police, which is really positive. So I mean, I'm hopeful that in the next kind of 6 months or so, that should be, you know, as fully completed as it can be. But although we haven't shared the full detail in the report, like Rachel said, that is going really well in terms of information sharing. We have an information sharing protocol in place, and the police are working really well with us, and children's services too. So things are looking really good, but there is kind of further work over the next 6 months or so to develop that.
Okay, thanks. That's great. So my third question concerns the explosion that there's been in accommodation development dedicated to occupation by senior citizens, and the increasing trend for those who live on their own and beginning to suffer cognitive decline to be in such accommodation, and the risk which I would perceive of them being vulnerable to non-familial neighbourly manipulation or even exploitation. And I'm wondering to what extent that is an issue which is on the radar, is a concern that may be real, and what the tactics might be to address that.
Thank you, Councillor Pinwell. So you're right, it is an area of concern for us. So a lot of the focus has been on transition, so young people turning 18, because they're already known to be at risk, and then they will come kind of into our services as adult social care, and we will continue to support them. However, we are seeing more older people, or people, you know, over the age of 18 that are at risk as well. So we have made sure that the training is available to all of the adult staff who are working with older people as well. And Age UK and other partners are part of the Safeguarding Adult Board, so they've been part of the strategy development around exploitation reduction to help with that work. Beth, I don't know whether you want to add anything as our kind of safeguarding head of service in relation to this.
Lizzie, I think just to mention on top of the kind of training that's being given to all of our adults frontline staff, obviously it comes back to the communications plan that Rachel was talking about earlier. and the phase around the communications to communities. So obviously raising the profile of exploitation, sort of having that common understanding about what the indicators are of exploitation, what people should be looking for and where to refer through to. So we see it all fitting into that communications plan alongside the additional training that our staff are having.
So just to follow up briefly on that, the sort of accommodation I'm talking about typically has an on-site manager, on-site warden, or on-site caretaker, call it what you will. Are they a specific target in this communications plan?
Yes, they are, Councillor Pinwell, and also they can access training through our safeguarding board as well.
That's terrific. Thanks very much indeed.
Okay, thank you, Councillor Pinwell. We now move on to Councillor Long.
Thank you, Chair. I had a question mainly relating to the screening tool. So I see that it's been officially launched in July of this year. Interested in whether that tool's been developed in-house. A bit of information about how it works, or what's the data that feeds into that? How do you ensure that it's covering all of the different groups that you've referred to? And essentially how many, it refers to use by professionals, how many people use that system, and then how that's, whether it's applying best practice from elsewhere.
Thank you, Councillor Long. So it is something that's been developed locally in Solihull. So previously we had an adults screening tool and a separate children's screening tool. The children's tool was very long, and we had some feedback from professionals outside of the council that it was taking a long time to complete, and you know, for staff working with a young person, it was taking a long time to do with that young person. So we basically had the aim to bring something together as an all-age screening tool. We have used information in terms of signs and symptoms of exploitation, and that's what it's based on, so that the individual working with someone who might be at risk looks at if those things apply to that individual, and then it gives an indication of whether or not they should be referred for further support. So we have used kind of best practice to develop it. However, really Solihull is leading, one of the leaders in terms of all age exploitation and having that focus on adults. So we haven't necessarily been able to take a tool from somewhere else, because lots of really we're kind of forerunning some of this work. So it's been difficult to get best practice in that sense. Rachel might want to add a bit more about how it's developed and how it's being used at the moment.
Thank you. So as Lizzie said, it was developed using the adults tool that we had already developed. And we did use some of Commentary had recently developed one for children using a signs of safety approach. And we used some of the good practice out of that to develop the adults tool. So the all age tool. So the all age tool it doesn't list types of exploitation. It lists behaviours and signs, as Lizzie said. It then leaves open boxes for people to then write in what their analysis is, what the evidence is that they're concerned in relation to those indicators. And at the end, the signs of safety approach allows questions to be asked to the person making or writing the screening tool about why they're making that decision, what the concerns are, and it leads you to looking at what happens next. So this referral can be made by any professional and comes into our one front door, where it will come to me and I will look through and I can screen it to see whether it's somebody that we can work with. If it comes into one front door, it does usually mean that it's somebody that we should be working with, and we'll at least explore that and support them under safeguarding processes.
Yeah, thank you. I think we all increasingly use tools, and they can be great support. in these sorts of processes. I just always have a concern at the back of my mind as to whether it's used exclusively, or whether you risk losing the human element, and to what extent there's additional eyes that look over the inputs and outputs of this process.
Just on that one, Councillor Long, we have made it clear in our training and our strategy and the awareness raising with professionals that if in doubt, they always need to contact either the adult social care front door or the children's multi-agency safeguarding hub. We'd rather have that conversation if anyone's in doubt, or if any professionals aren't able to complete the tool with the individual who might be at risk. So there's always that option to make the contact over phone or our online system as well.
That's been really helpful. No further question on that, Chair. Thanks.
Thank you, Councillor Long. And next question is Councillor Howell.
Thank you, Chair, and thank you, Lizzie, Rachel and Beth, for your update on this really important topic. Really good to see that we're involved in the community in this strategy. We're using the community's eyes and ears to identify individuals at risk, and good to see the communication tools included in the appendices of the report as well. It strikes me that these communication tools are going to be displayed in a lot of public places, so they will hopefully also be seen by people who are being exploited, people who may not identify as being exploited. Do we have a thread of the strategy as to how we can actually get people to safely identify themselves as being exploited and safely seek help?
Thank you, Councillor Howell. So like you're saying, we are hoping that individuals might recognise themselves in the communication if they are at risk. So obviously that's one strategy in terms of making things available. Also using our community wellbeing hubs and the providers that we currently work with to make sure things are displayed and shared through them as groups as well. Also community groups in Solihull. I guess there's nothing specific that we've tried to look at aside from that in terms of individual self-awareness, but I don't know, Rachel, if there's anything you've talked about through the delivery group that you want to add aside from the communication plan.
Well, I suppose it's just going on with the communications plan. So phase 4 is based at people, so which will include people who are being exploited themselves. The comms that are in the appendices for phase 3, so they're very much targeted at people being aware of the signs to look for in other people. Our phase 4 will be comms around people trying to identify it in their children, themselves, those kind of things. So we will be looking at how we can use our comms to try and help people become aware of exploitation in themselves, their family members, friends, and those kinds of areas.
Okay, that's really good to hear. Because I think obviously just the whole ethos of the comms would need to be slightly different and almost more reassuring, wouldn't it, if you were then actually identified yourself, and you would need that reassurance that there was a very safe space for you to go and report. So that's really reassuring to hear that there will be additional comms looking at that.
Just to add on that one, Councillor Howell, we do have through the exploitation partnership, we do have some comms expertise that are supporting us with this and our engagement lead. So just to reassure you in that sense that we have got some comms professionals involved, and obviously information will be tailored at the stage 4 of the communication plan to make sure that it is friendly to members of the public.
That's great. That's good to hear. Thank you.
Okay, thank you for that, Councillor Howell. Before I sum up, are there any further questions from members? Okay, I see none. Right, this is a very particularly critical subject area, but particularly for those that depend upon us to exercise something of a duty of care, to bear down on these issues. and to ensure that people don't have to suffer the awful consequences of them. So from the point of view of the report, because this is not an open board, it's a closed officer board. Yeah, appreciate that, I get that, appreciate that. But it does mean that we depend totally on the reports that you present to us to give a full picture of the undoubted amount of hard and urgent work that's going on this board. We'd also appreciate that we have more councillor training to increase the knowledge of the members, because there are 51 members out there who may have something to contribute to in the bearing down on these issues. Good to see that you had timing for the phases of the work that you're doing, the 4 phases, but it would be nice to have that added to the report. As this report will come back just to be approved in the next meeting, we have the opportunity to cover these items. It's nice to be clear that this is an all-age plan, and there has been some question from councillors, particularly about the results that you're getting from the strategy, and what kind of a summary. I mean, I understand the sort of need for privacy of some of the individual cases, but we'd like to see a little bit more information on how the strategy is going. It gives us an idea of whether we've got the right strategy and that we're getting the results that we owe it to those that we protect to obtain. Yeah, recommendation is that when this returns to the board, probably quickly at the next meeting, is that that we actually have a response to these items. Particularly also that in the case of exploitation of older people. I'd like to see something. I'd like to see something on each of the, well, we would like to, as a board, like to see something on each of the categories that you're dealing with. Because dotted through this, there are various, I know it's an all age plan, but there are some things that affect older people and some things that affect younger people more. It'd be nice to see a fuller picture. There also that a little more information on the screening tool and the details in use, maybe a bit of flowchart and things like that, so we can see what kind of things that are being done to deliver this strategy. And finally, the opportunity for self-identification for individuals who believe that they're in a situation which they're finding it difficult to handle. Okay. With all of those things, I would like to recommend that the Health and Social Care Scrutiny Board has to note and support the work being undertaken. There's little doubt of that, but we'd like to see a little bit more detail that the responsibilities that we all have are being discharged as well as we possibly can. Okay. Are there any other recommendations that members would wish to add to that? Have I covered everything? I see none. Okay, we now move on to item 6. Supported employment for people with learning disabilities. This is to provide an update on the progress made towards developing supported employment opportunities for people with learning disability, specifically for individuals where adult social care outcomes framework, or ASCOF, measure 1E applies. Open brackets, proportion of adults with a primary support reason of learning disabilities with a long-term support event in paid employment. Council officers delivering this are Lizzie Edwards, Assistant Director for Service Delivery, and Pete Budge, Head of Service, Adult Care and Support.
Thank you, Chair. Again, we have some PowerPoint slides to accompany the report, so Joe is just getting those up on screen now. Thank you. Thanks, Chair. As you mentioned, this report relates to improving employment opportunities for people with learning disabilities specifically. So hopefully you've had an opportunity to all digest the report, but I will offer some highlights through the PowerPoint slides. As you said, Chair, I do have Pete Budge here, Head of Service, who's responsible for this area. Could you move on to the next slide, Joe? Thank you. So obviously this is a really important subject in terms of access to meaningful and fulfilling employment opportunities for people with learning disabilities to further their independence, choice, control over their lives. We've put some examples there up on the screen of the types of employment that some of the individuals that we as adult social care work with are involved in. So we do have individuals employed in administration, hospitality, grounds maintenance. So that gives you an idea of the flavour of roles. Obviously there's more than that, but they're the kind of main roles that we see individuals accessing. There is a national adult social care indicator, so the ASCOF indicators relating to the level of employment for people with learning disabilities who also receive a package of care from adult social care. So this is basically looking at all of the adults with learning disabilities who receive care through the council, what percentage of those are in paid employment. So that is something that is reported nationally at the end of every financial year. Prior to the COVID-19 pandemic, we did have an action plan in place. And as outlined in the report, we were seeing improvements in terms of the level of individuals employed. So that was really positive. Unfortunately, this has slipped during COVID. And this report outlines the next steps that we've agreed in terms of improving employment opportunities for residents with learning disabilities in the borough. So I'll hand over to Pete Budge, the Head of Service, who leads on this area, who'll give you a bit more information in terms of our approach that we've been taking and the next steps.
Thank you, Lizzie. Good evening, Chair, evening Board. So our approach, as outlined in the report, we've been working with partners, including the Employment and Skills team, Human Resources, so a company called Ideal for All, social enterprise company, who are commissioned to work directly with individuals, and another social enterprise called Experts by Experience, amongst others. That's our multi-agency group, and it's in place to coordinate this work. We also have a supported employment coordinator role within adult care and support. We're currently out to recruitment at this post. We have had some difficulties recruiting to, but it's out to advert again now. And it's seen as being a very instrumental role in developing links with employers, families, residents, partners. And it's very much a hands-on role and a really valuable link for us to have from the adult care and support side. Just to go back to the role of Ideal for All, who I mentioned, they are a social enterprise company contracted to work with adult care and support and residents, and they are the supporting organisation, if you like, to take people through the processes and requirements that are needed to enter employment. So they do close work with residents around CVs, for example, arrangements for attending work, linkage with employers. They develop information about myth busting, which to try and overcome barriers that people may perceive, information for families, individuals, and provide reassurance for residents too. They actively provide feedback for people and planning where interviews and applications are unsuccessful, and link with relevant agencies, including, for example, social work, our internal employment and skills, and external employers, and encourage them to become disability confident, for example. So in May 2021, the corporate leadership team agreed to directly recruit 10 individuals with learning disabilities within the council, and these roles are now being progressed, which will mean that although the ASCOF target, like as Lizzie mentioned, hasn't been performing as well as we would have liked during COVID, if we do progress these posts, that target will be met, and that has been outlined in the report. And the projections are there for you to see. I think there's some pink bar charts there to refer to. Could I have the next slide, please, Joe? Thank you. So the next steps then, as seen in the report, over the coming months, these include a little bit of an overview. So looking at what businesses and companies we contract with as an organisation in the council can support with around getting social value from them. What can we contract them to incorporate and work to use? So there is something called the National Social Value Measurement Framework, which we intend to use, which is a nationally recognised tool in this area of work, and Inclusive Growth are leading on this area, which we are plugged into also. We intend to work with a really good example here around with in-house day services, who currently have a catering contract, which they have in place. They're hoping to renew, but what they'd like to do is undertake some likely opportunities here that we can use for people with learning disabilities, which would be a fantastic opportunity to take further. And we're looking to develop opportunities with further social enterprises, such as, for example, Coalbridge Trust and Newlands Bishop Farm, to refresh opportunities which may have been paused during COVID and the inevitable impact that that's had on everyday working. We envisage improved opportunities as a result of these actions over the 12 months going forward, but I think that's a good overview. So again, happy to take questions and comments if we can.
Thank you for that. Well, question that I had about this is a little bit like in function, like an employment agency. The objective being to sort of unite the right person with the right opportunity. I mean, it seems to me a little bit like when we look at the way that people of varying ability are chosen for Olympic sports in the disabled Olympics, that people may be in effect classified to make it much easier to bring the right person to the right employer that already has the abilities required for the sort of tasks expected and the activity that goes with that. Has that been considered? Do the agencies that you use consider that?
Thank you, Chair. I guess that it would be quite difficult to categorise individuals with varying wants and needs and skills in terms of employment. However, the company that Pete mentioned, Ideal for All, do complete an assessment of an individual in terms of their skills, their interests, their previous experience, and then work with employers to identify suitable opportunities based on those things. So I wouldn't say it's an exact science, because that's very difficult when you're working with an individual who's got various skills and desires in terms of what they want out their working lives. But it is the approach we take in terms of an assessment's conducted to understand more about that individual, and then there's the kind of job matching process, looking at what jobs we have available at the moment. And also that is the approach that we're taking for the council jobs. So we have been in contact with individuals who receive care through the council to discuss, you know, like what their skills are, their interests, their previous experience, and we've tried to, it's called job carving. We've tried to carve out roles that will be suitable for individuals to make sure there's a good spectrum in terms of, like Pete said, there might be some in catering, there might be some in terms of grounds maintenance, some administration. So we do try and work in that way, but it's not an exact science.
Yeah, I do tend to find, as we're all probably well aware, it's not an exact science in the non-disabled world either, when we're uniting people with the right activities, and it's an all-age business. Is there an opportunity for self-assessment for any of the individuals concerned? So where they say where they think they are or where they're working to, if towards?
Yes, there is. So as adult social care, we do have a self-assessment offer, and part of that considers employment opportunities. So individuals now can complete a self-assessment online, and they can tell us their kind of interests and what their experience has been. We can also offer that in like a paper version, because I know not everybody's able to use the internet. And then the social worker or Ideal for All can discuss the circumstances with the individual. So that is an option, yes.
Mm-hmm. Okay, so members, what would you like to add? Councillor Pinwell.
Thank you, Chair. I really should start with a declaration here. As a number of people on the call will know, I have some history working in pathways to employment for learning disabled people. And I'm well aware that the performance below national norms long predates your involvement in this matter. And it's good to see us making an attempt to catch up here. You're actually doing yourself a disservice. I don't know whether you know this, probably not. The graph, the first of the graphs that you showed, shows the national picture fairly level at 6%, whereas in reality, the national performance on 1E dropped from 6 to 5.1 in 2021. So actually, the fact that you sustained the drop that you did probably was outperforming the national norm, but the graph doesn't show that. Nevertheless, there are, I'm not sure who the strategic neighbours are, but I've always been told that Trafford is a big comparator with Solihull. And the performance on 1E from Trafford is at 11.9%. And there are quite a few places who do a lot better than that. And one that particularly struck me is Wokingham, where probably the amount of employment opportunities and the breadth of employment opportunities available shouldn't be too dissimilar to those in Solihull, and Wokingham is performing at 19.3%. So I'm just wondering, as a first of three questions, whether you have looked at comparator councils and what tactics they're running to see what can be learned in prioritising within the strategy.
Thank you, Councillor Pinwell. Yes, we have done an exercise where we've looked at our statistical neighbours, and then had a look at what they're doing in terms of supported employment. It is quite difficult to benchmark, because I know different places record things differently, and we want to make sure that we're doing things consistently. So Pete mentioned the supported employment coordinator role that we're hoping to get someone in post for very soon. That is one of the things on their list, to revisit the high performers, to look at what they're doing in terms of if there's anything we're missing on our action plan. So we have done that, but pre-COVID, and it's something that we need to pick back up on now. So it is something we will be doing. I know that one of the aspects of the report is around the corporate leadership team decision to directly employ 10 individuals. That is one of the actions that came out of the work, where we discussed what other councils are doing, because another council we asked had said that they have directly employed individuals, and then that helps them in terms of their stance when talking to other businesses and looking at social value, like Pete says, because then we can say as a council, we are committed to making a difference. We've done this directly. What can you do as a business, or as a business that we contract with? So that was the idea of that, and that did come directly from looking at work that's happening elsewhere.
Okay, thanks very much. Second question. Those of us who've been involved quickly learn that the jobs which learning disabled people really take to are those with a significant level of routine in them. One of the points that was put to me recently, which I think is worthy of repeating and asking the experts here, is whether there isn't opportunities in the world of social care where teams of 2 are going in to support elderly people, for example. And clearly those are matters of routine where the teams are making breakfast, making beds, helping to dress, giving tablets, those sort of things. And given that form of employment is proving difficult to attract people into at the moment, is there an opportunity there to add that to the list of employment opportunities for learning disabled?
Thank you, Councillor Pinwell. Yes, it is something that we've been thinking of. Pete mentioned earlier around our day opportunities service. So they are hoping to have at least one of these council roles in terms of supporting people who attend day opportunities. The thing that we've found really important in terms of sustainable employment, rather than just routine, is ensuring that individuals with learning disabilities have someone supporting them in the role, and also someone who is aware of learning disabilities and has some training and is able to approach the situation with some experience. So what we want to make sure as a council is that the roles that we're taking on do have that support available. So it's not necessarily that we've looked at kind of routine jobs, it's whether we have the right people in the team who are committed to supporting individuals and learning and, you know, having that training which will be on offer. But yes, in short, we have been looking at social care as an opportunity, and we're going to try that out with our day centres.
Right, that sort of leads me on to my third question then, which goes back to my own experience. What we were doing when I was involved in it was trying to establish a pathway, and a pathway particularly from special schools through to employment. Now, we were concentrating on the production assembly area of work. And within that pathway, there were clearly 2 potential significant points of failure, both transition points at either end of the bit of the process that we were trying to run, which was giving work experience to those migrating into the employment world from school, and then migrating on from work experience into permanent employment. Both of the transition points were risk, and as you were just indicating, required a heck of a lot of support on both sides. And actually breaking up that transition point by giving progressive work experience coming out of special school during year 11, is it? And then providing continuity by having backward links into the school during the early period of work experience was important. And then doing a similar thing when it came to trying to move individuals forward from a work, have improved themselves in the work experience environment and got the fact that they were work ready onto their CV and encouraging them to apply for jobs, to try and reach agreement with employers that there could be ongoing support from the team that was actually leading them through the work experience phase. So I was very encouraged to see these internships that you were planning, which I think sort of mirrors the first transition point that I was talking about. I was wondering whether you'd done any work around trying to find employers who were able to offer the sort of support from those who knew the individual into the new workplace at the next transition stage.
Thank you, Councillor. So we have concentrated a significant amount of our effort on transitions because we think that that's where we could have the most impact in terms of ensuring that young people and their families know that employment is an option. So I know that a lot of families are thinking about college, day services, so it is something that we've included in terms of our awareness raising around transition and making sure that employment's being thought about. So Solihull College, like you're saying, are doing a lot of work around supported internships, which is fantastic. It's definitely something that we are taking on as a council, so some students so they can have an internship placement at the council. In terms of the next transition you mentioned, where people are then going from the internship into further opportunities in employment, Ideal for All, the company that we directly contract with, do work with employers to organise work placements or work experience, so that is opportunity is available to individuals to get experience and also to see whether something's right for them. And also Ideal for All offer that support to the employer and the individual for a longer term basis whilst they're settling into the role. So they'll meet with the employer and the individual as well. So we do have that support available. However, this supported employment coordinator that will be working for the council will be furthering those opportunities. So seeing what else we can get in terms of shorter term placements to, you know, make sure that those transition points are all covered. So it is something that has developed, but we've got more work planned.
Thank you very much. That's sorry.
Okay, I take it you went quiet at the end, Councillor Pinwell, but I think that you've completed your questions. Thank you. Next, Councillor Sexton.
Hello there. Thank you, Chair. I've just got a couple of relatively brief questions. You mentioned that we're working with Ideal for All in particular. Can you tell me, is there any outcome monitoring in place there, and what's the nature of it?
Thanks, Councillor Sexton. Yes, there is. Our commissioning team manage the contract with Ideal for All, and Ideal for All have to submit returns detailing all of the meetings that they've had with individuals, how many individuals they supported into employment, how many work placements they've organised. So all that is monitored by our adults commissioning team. So Ideal for All submit the returns, and then there's also contract monitoring meetings as well.
Excellent. And how long is our contract with them? Is it what are the procurement arrangements around that particular work?
So I don't know off the top of my head, Councillor Sexton. I'll have to come back to you. I'll provide a written update to the board.
No problem. That's fine. My other question was around, can you tell me the eligibility criteria for people being involved on this particular scheme?
Is that in terms of being involved with Ideal for All, Councillor Sexton?
For the people who we are supporting in the context of this agenda item, as far as their disability is concerned, what are the eligibility criteria for them to be involved on that pathway?
Okay, so this relates specifically to individuals with learning disabilities who meet the Care Act eligibility criteria and are in receipt of a package of support. So this is the update, and Ideal for All will support those individuals. However, the contract for Ideal for All is wider than that. So they will support any individuals who are referred in by social care or are self-referred, in terms of they require some support around their employment because of a disability or illness. So it does cover people with mental health conditions as well. So we don't kind of limit the remit in terms of that. And also we have further work happening in terms of other disability groups to support those individuals. It's just that the ask-off indicator, so the national indicator, relates specifically to individuals with a primary need relating to their learning disability who receive a care package.
Thank you, that's great. And yes, I mean, we've talked a lot about the ASCOF indicator in previous meetings, so I'm aware that that's particularly important. But just sort of as a wider piece, I am very interested in sort of the support we're also providing to people with other disabilities, such as non-learning disabled autistic adults and people with ADHD, for example, as well. So they would be eligible for support from Ideal for All.
Yes, that's right, Councillor Sexton. And also the supported employment coordinator who we're recruiting for the council will be able to support a wider group of individuals with different disabilities.
Fantastic. Thank you very much. That's great.
Councillor Sexton, could you just remind me of the detail of your second question, because I didn't catch it well on this here.
The question was around what are the eligibility criteria for being supported, both in the context of this question and more broadly, the group of people that Ideal for All are supporting.
Yeah, if I could add to that, does this also expressly include people with physical disabilities?
Thank you, Chair. So the ask-off indicator is around individuals with a primary need relating to their learning disability. But yes, we and Ideal for All will support individuals who are physically disabled as well.
Okay.
Thank you.
Yeah, okay. So Councillor Long. I could come back to Councillor Long. Councillor Howell.
Thank you, Chair, and again, thank you, Lizzie and Peter, for another really interesting, really important report. Really good to see that we've got some linkages with colleagues in inclusive growth. It also strikes me that this links in quite nicely to our health inequality strategy, the draft of which we considered at a previous scrutiny board meeting. So I'd be interested in any comments there and any linkages that you're doing with colleagues producing that strategy as well. The other, my first specific question though is regarding the role of the supported employment coordinator. It strikes me that that's going to be quite pivotal to the success of this strategy, and I think, Peter, you did allude to the fact that that post wasn't yet fulfilled and there may have been some challenges in recruitment there. I was just wondering whether you've been able to identify and overcome any of those challenges, and when might we expect a successful appointment to that post?
Thank you, Councillor Howell. So yes, we are involved in the health inequality strategy work, so fully linked into that. And I know that supported employment opportunities in the wider sense is kind of a part of that work. And like you said, we do have our project group, which we've mentioned in the report, that involves colleagues from across the council. So in terms of your work around recruitment, Pete might want to add to this, but we have now redesigned the job description to make sure that that it is a kind of sufficient seniority so that it may attract the right individual. And also we've been advertising in some places other than just WM jobs, so making sure that we're making use of all of our kind of recruitment opportunities, and we've definitely had a lot more interest recently, so we're very hopeful this time. I don't know, Peter, is there anything you want to add on that one?
I don't think there's an awful lot to add, no. I mean, it is worth saying that we have had more interest, which is really encouraging this time, and we've made real attempts to share it far and wide. As Lizzie mentioned, we have reevaluated the post as well, which has seen it rise in terms of its banding, which makes it more attractive. It is actually a really competitive and appealing post now. We've also advertised it in different areas, including the British Association of Supported Employers. So we are feeling more optimistic this time, with a view to it closing in the new year, and hopefully interviewing second week of January.
Great. That's good. That sounds positive. Let's hope for some good news on that in the new year. I've just got two further questions. You mentioned working to understand what job ready means. What support is available though to get these residents with learning disabilities to be job ready? How are we helping to facilitate their personal growth to actually achieve that?
Thank you, Councillor Howell. Yes, that's right. We want to make sure through this work that all of our kind of professionals that work with individuals with learning disabilities and our contracted providers have a shared understanding of job ready, because I don't think that's necessarily the case. In terms of support to individuals, obviously social workers through their assessment will identify the kind of right level of support for an individual. So that can include anything in terms of day opportunities. So our internal day centres, for example, do work with individuals to support them to be job ready. So things like sticking to a timetable in terms of timekeeping. We do offer some travel training to support individuals to get to work, understanding money, those kinds of things. So our day centres do some work around that. And obviously people have individual packages of support like supported living, and those care staff will work with individuals to support them to be as job ready as possible. At that point in time, they can then be referred to Ideal for All for the further support on an individual basis.
Great, that's good, thank you. And then my final question, it really relates to how are we going to be evaluating it in the most global sense? So obviously we can look at pure hard statistics of number of people who are benefiting from this strategy and are actually gaining employment, but are we actually going to look at the positive effect that we're having on these individuals' lives as well? You know, we all know the benefits of work are very, very wide, aside from the obvious financial benefits. You know, being in meaningful employment helps to promote good mental health, increase confidence, develop social skills, etc., etc. Are we actually going to be looking at people using this strategy in that sense, so we can actually capture what difference we're making to their lives?
Thanks, Councillor Howell. I've probably mentioned at a previous scrutiny session that we do conduct like a survey or engagement piece of work with every individual that we work with. So that will be part of the information that we're gathering in terms of, you know, if they were able to be supported to gain employment, then we'll get some feedback that way. But also, yes, we'll be collating through the supported employment coordinator some case studies, and Ideal for All already do that, I understand, as part of their contract management that I mentioned earlier as well.
That's great, thank you, and apologies if I missed an update on that in a previous scrutiny board, but that's lovely, thank you very much.
Thank you. Councillor Richard Long.
Thank you, Chair. Yeah, I lost my signal when you called on me previously. I just saw lots of whirring icons. I had a question relating to the graph that's on the top of page 29, part of section 4.3. I was looking at that and trying to work out how many people are actually in this group. And if all the roles, these new roles, represent those percentage increases, then it seems like we're talking about 500 individuals there or thereabouts. So I was just interested whether it is around that number, and then clearly if it is around that sort of 500 mark, we're talking of 25 people in employment, which is good. I mean, clearly great that the effort goes in. I'm then just interested what sort of work ready or equivalent support is offered to the 95% that aren't part of this group in employment, whether there's, I think you've mentioned some perhaps day opportunities, maybe volunteering, third sector sort of work as well, that they're clearly hoping or expecting they're not neglected as part of achieving this target, that this isn't dominating the support for the other larger group.
Thank you, Councillor Long. Yeah, your maths is right. There's around 500 individuals with learning disability supported by care packages through the council. So in terms of individuals not in employment, every assessment that our social workers complete has a section on work, education and employment. So it's always considered as part of our assessment and our care planning. So even if an individual is not wanting to seek employment at that time or isn't job ready, like we mentioned earlier, that will still be part of the discussion and the consideration. Obviously, some individuals, don't want to have support around employment. They might want to look at education or other opportunities. So it's all tailored to the individual, but it is always discussed and support arranged if that individual wants that as part of their care package for their eligible care needs.
Thank you for that. And my other question related to the major employers within the region, to what extent the council engages with them to help them identify roles that could support individuals within this group.
Thanks, Councillor Long. So I probably can't give you too detailed an answer. I'm aware that our colleagues within other directorates are the main links with main employers in the borough. So like I said earlier, they are part of the project group. Pete, I don't know if there's anything you want to add in terms of the work you've done with employment and skills.
Well, actually, yeah, I mean, employment and skills, absolutely. But it's worth mentioning as well, Councillor, that we met just yesterday, the group did, and Ideal for All came back with an initial idea with regards to exactly that and approaching employers with a view to promoting disability confident, the scheme to encourage employers to become disability confident and explain to them the benefits of both employing and supporting people into employment and the benefits it brings to the business as well as to the individual. So that's a piece of work we will be taking forward in the new year, certainly. As Lizzie says, we can certainly come back to you with further information about employment and skills and what's going on with partners in the council.
Yeah, I'd be interested in that. Thank you. Councillor Pinwell at the start picked up on important point in that regard about other local authorities, comparators, benchmarks, and particularly any learning we can gain in terms of how they've managed to get the numbers much higher, and whether that is around sort of proactive engagement or as you started looking at internal roles within the council as well as perhaps a stepping stone to that, or providing permanent roles. Thank you.
Councillor Long. Yeah, like I mentioned earlier, that was seen as an opportunity to then work with further employers in the borough to say, like, we've done this as a council, what can you offer? And as Pete mentioned earlier, the organisations that we have a contract with as a council, looking at what they can provide in terms of that social value aspect of their contracts as well.
Okay, thank you, Councillor Long. Are there any other questions from members? Yeah, I see none. Well, I'll now sum up. I think that what comes out of this is that everyone, no matter what their situation, it has potential. And that potential isn't necessarily reflected in their current situation. It's very much up to us to help people to understand that, and that there is a lot of dignity involved in the journey of going from the current situation to a better one. And coming onto that is how we judge our own performance in these areas. I mean, the idea that we're going to judge ourselves against national averages, we don't, as you see, we haven't got a lot of enthusiasm for that, compared with running in comparison with the other high achieving areas. The people have an element of beaconicity and offer us opportunity to join them in being the best and doing the best to help people achieve their potential. And also there is considerable value to society when that happens. It's that's part of the achieving of the dignity of work. Right, coming on to the next part of it was that we do need to be perhaps a bit more clear about the pathway from school, work experience, permanent employment, and how the work-ready parts of that fit into it. What facilitation is available for those that are making that difficult transition from the parts of it that we provide to take people forward in the direction of their achieving their potential, is ensuring that the support's there when they move into working for the employer and expected to deliver something on a daily basis. Right, from there we can move on to outcome monitoring. Maybe some better reflection of the performance against the contracts that we have and how the providers that we're using are achieving what we're working on. Also, we need a little more detail on eligibility criteria. It's learning disability, physical disability, and the help available for our autistic people of all ages, autistic children that may well become autistic adults, and how we continue to help them go forward with their lives. And that the work we do with them helps them in their daily life, which is as important as anything. Because if you're going to have a working life, your daily life needs to fit together well. A lot of these are mirror reflections of the main employment market and how people perform. I mean, there are a lot of expectations of people in the mainstream market, and many of the problems can be the same. We need to take the same care and ensure that the employers take the same care, as they often do in the mainstream, that it's not seen as a Cinderella area. Last item, the appointment of the employment coordinator. Good to see that the role has been re-evaluated, and we'd like to continue to monitor progress at getting someone into role on that. Also, that we include volunteering in this, because volunteering is often a key part of the journey. So thank you for a fairly detailed report, and it's good to see the work that's going on to help people, that give people that helping hand to head in the direction of their potential. Thank you. Are there any other recommendations that members would like to add to that? I see none. Thank you very much, officers, for the presentations of those two reports. We now take it members are happy to support the ongoing work that we've had discussed, shown to us this evening, and to provide further feedback in line with the recommendations. Thank you. So move now on to item 7, work programme. Have we got a copy of the work programme available for everyone? It's in the package, but do members have anything to add to that, as we're a fair way down the annual programme now? Any comments, or everyone's happy to continue with that as planned? And perhaps at some stage we will start to discuss what flows on in the coming year also. Okay, thank you very much, everyone. Are we happy to approve continuation of the programme, members? Thank you. Well, thank you for everyone's hard work this evening in joining our meeting. Just to reiterate that we will formalise the acceptance of these reports at the next meeting. And thank you for your work during the year, both officers and members. And with that, I bring the meeting to a close.
Thank you, Chair.
Thank
Have a
you.
good Christmas.
Thank you, Chair. Merry Christmas, everybody.
Merry Christmas,
Yep.
everyone.
Thank you.
Yeah, Merry Christmas all.